The death toll in the United States from coronavirus will likely hit 10,000 people today. President Trump continues to say that nobody could have seen this coming, but our next guest did. Years ago, he came up with a pandemic tracking system for the city of New York, and last month, his data alerted him to what was coming with coronavirus. Now he has a message for the rest of us. Joining us now is the CEO of Aledade Incorporated, Dr. Farzad Mostashari. He was a top official at the health departments for New York City and the U.S. Dr. Mostashari, great to see you. I know this is pretty technical stuff and it involves data, but maybe you could just explain that you came up with this unique technique for, I guess, tracking global pandemics. It was sort of an early warning system, and you used it with the swine flu. And so for the layperson, how did it work?
The fundamental idea here was that instead of waiting for people to be tested, the lab results to come back, and we've all seen so much of the challenges and the delays in getting lab-confirmed tests as an indicator of outbreaks, is just actually looking for symptoms, looking to see how many people are going to the emergency room, how many people are going to the doctor's office with cough and fever, nonspecific symptoms, and to track those using statistical methods and see when there may be an early indication of an outbreak coming. That's what we saw in New York City very early on. Actually, the very first case was diagnosed in New York City on March 1st. By March 4th, there was an increase in a spike in fever, cough, respiratory difficulty breathing, emergency room visits. Weeks before the city was shut down. This data is now available throughout the country, actually. When I was the U.S. National Coordinator for Health IT, we required hospitals who were adopting electronic health records to report to public health every day their emergency room visits and allow public health to monitor them for these outbreaks. And we have the data in every city and state, but it's only New York City that has made it public. And that's what we need, is we need more transparency in terms of not just the number of cases every day that is on every Chiron and every health department's reports, but we actually need to know what's happening to illness in the community. How many people are going to the emergency room with cough, fever, to see if when is it starting to go up? And then hopefully, when does it start to flatten out and begin to come down as the earliest indications that we're getting through this pandemic?
I think this is really interesting. Basically, you're saying we have the technology to have seen this coming. And what you saw was just a spike in symptoms, and it was beyond the seasonal flu. And so if somebody could have seen that and sounded the alarm, in an official capacity, maybe hospitals could have begun getting ready because, again, you say that the signs were there. And so is it your impression that New York was too late to notice this, and the CDC was too late to notice this, and the White House?
I think that these are smoke alarms, and smoke alarms need investigators. They need firemen to go and investigate to see what's actually going on here. So actually, New York City was just the only one who has made it public. I'm sure there's many other places, but what we needed to do was quickly investigate those cases. Are they worried well? Is it flu? Is it some other virus? We need to be able to have the public health resources to be able to investigate these, the boots on the ground to go and get to the bedside and figure out what's happening rapidly. And every time we have a pandemic or some big public fear, we put some money into public health, and then between two panics, we get complacent and we cut funding for basic public health infrastructure and resources to be able to investigate these. So, look, we're here now, and I think moving forward, what I'm most concerned about is that we bring that same level of transparency that we had in New York City in terms of what's happening day to day with emergency room visits for respiratory complaints and others. We need to bring that to every other state, and it should be just part of the standard thing that everyone is asked, because the data is there. We need to be using it. We need to be looking at it. We need to be seeing what's happening to emergency room visits.
That's just so important. I mean, the fact that it already exists, the data is there, the collection is already happening, the smoke alarm is already going off. We just need to be able to hear it. And I know that you're also talking right now to general practitioners, and you want to sound an alarm about what they're telling you. So what are you hearing from them?
Yeah, our company supports primary care practices 550 of them in 30 different states. These are the frontline practices. all throughout the country, and they are serving their communities, and they're suffering. They are dealing with the same shortages of masks and gloves and protective equipment. They're being exposed at risk every day, their staff. But the other challenge that they're facing is as they are pushing patients to stay home and stay safe, they're doing parking lot visits and tons of phone calls, and they're doing porch visits. Their incomes are going through the floor, and these small practices may not survive. Just at a time when we need these frontline practices the most, we're actually not supporting them, and they could be in serious financial trouble. So we are sounding the alarm. Our practices are going to be fine, but there's a lot of community family practices and the family doctors who, just when we need them the most, when we're asking the most from them, are going to be going out of business.
That is an important reminder for all of us. Dr. Mostashari, thank you very much for explaining all of this in layman's terms for the rest of us. We really appreciate it.